and welcome to Diabetes Connections in the News. I'm Stacey Sims, and every other Friday, I bring you a short episode with the top diabetes stories and headlines happening now. In the News is brought to you by Edgepark. Simplify your diabetes journey with Edgepark. Our top story, the ATTD conference wrapped up earlier this week. That is the Advanced Technology and Treatments Conference that takes place in Europe. It was in Italy this year. Lots of news and studies. We will touch on a few, but links to additional reports will be in the show notes. I also have a link to every story I feature. We do that every week. Now, from where I sit, not in Italy, it seems to me that the two big stories from ATTD are CGM options and patient involvement. The latter has come a long way, with more patient voices being included on the conference floor and in more studies than years ago. In terms of CGM, there are more than 30 in development, and we got news about some of those. First, the established players. Dexcom announced that the FDA has approved Stelo, their new CGM, meant for people with type 2 who don't use insulin. We've covered that a lot, but the surprise here was that it was okayed for over-the-counter distribution. No pricing info yet, much more to come on that. Dexcom also announced FDA approval for G7 direct-to-watch connection, and that means no smartphone needed. The G7 will transmit directly to Apple Watch. Both Stelo and this feature are expected by the end of summer. In terms of studies, new data shows long-term use of an AID system powered by Dexcom can safely maintain improvements in glycemic outcomes for up to 2 years. Real-world evidence showing a reduction in severe hypoglycemia and diabetic ketoacidosis over 12 months in people with type 1 using a Dexcom-powered automated insulin delivery system. And another new study showing an association between Dexcom CGM use and a meaningful reduction in A1C for people with type 2 who use a GLP-1 medication. The folks at Abbott releasing a similar study about the Freestyle Libre, showing that people with type 2 who use GLP-1s saw a significant improvement in their A1Cs after adding the Libre. Better A1Cs were achieved regardless of GLP-1 duration, type, or insulin therapy type. Roche debuted its first CGM, and they say it utilizes predictive AI. The company unveiled AccuCheck Smart Guide, which features a 14-day wear time. It does require initial calibration. This is a good time to talk about MARD, which is how CGM accuracy is measured and reported. The lower, the better. The Roche AccuCheck Smart Guide has a MARD of 9.2%, the Dexcom's G7, 8.2%, and Abbott's Freestyle Libre 3 comes in at 7.6%. I'll link up more about that because a lot of it has to do with how long they are measuring and on how many people. Another CGM gets approval. This is in South Korea, and it's their first locally developed CGM. It's called CareSense Air, developed by blood glucose device maker iSense, is supposed to be the smallest and lightest CGM device available in South Korea, which is significant because Medtronic, Abbott, and Dexcom all have CGM approval in that country. The CareSense Air can be used for 15 days straight, and they say it features a calibration mechanism. They are looking for European approval, and they say they're going to start marketing it in the first half of 2024, which is now. As I said, a lot of CGM news. Elsewhere, Mankind Corporation announces initial meal challenge data from their INHALE-3 study. This is a phase 4 clinical trial in the U.S. evaluating their Afrezza product. This is inhaled insulin. So the trial is looking at inhaled insulin plus basal injected insulin versus standard of care. So people who used inhaled insulin experienced significantly reduced post-meal blood glucose spikes compared with those who used subcutaneous rapid-acting insulin delivered by MDI or pumps. The area under the curve, which is under a blood glucose level of 180, was reduced by 20%. They're in the middle of this study. It's a 17-week study, and the final results will be presented at the American Diabetes Association's Scientific Sessions. That's in June in Orlando. It is the next really big diabetes conference. A new eye drop could mean a much simpler solution for diabetic eye disease. Current treatments for diabetic retinopathy and diabetic macular edema are invasive and include medication injections into the eye and laser therapy, New study on the eye drops reported them safe and tolerable. 100% of people stayed in the study, which is significant. And researchers say there were significant changes in the eye, which looked good. The drop is just called EXN407 for now. It's reportedly the first topical treatment for retinal vascular diseases. High doses of vitamin D may prolong the remission period of type 1 diabetes by preserving function of those insulin-producing beta cells in newly diagnosed patients. This was a small clinical trial, 36 young people ages 10 to 21 years old, randomly assigned to receive vitamin D or a placebo for up to 10 months. The vitamin D supplementation improved insulin secretion capacity of beta cells, and the researchers noticed a longer delay in the loss of C-peptide. Right back to the news, but first, Diabetes Connections is brought to you by Edgepark. And managing diabetes doesn't need to get in the way of your passions, your social life, or your budget. Edgepark can help you simplify your diabetes journey so you can focus on other important things. Edgepark offers a wide array of continuous glucose monitors, such as the Dexcom G7, Freestyle Libre 3, and more. Plus, Edgepark accepts most insurance plans and handles the paperwork. Visit diabetes-connections.com and click on the Edgepark logo to learn more. Back to the news, and in the UK, Oxford University researchers are establishing a national registry to track people at risk of developing type 1. The measure is targeted at people who test positive for diabetes autoantibodies, and the idea here is to share information about upcoming treatments and opportunities to participate in research, such as trials of immunotherapy treatments. The FDA announces it will let yogurt producers say that eating their products may prevent type 2 diabetes, but the labels also have to say that this is based on, quote, limited scientific evidence. There has been some research that supports this claim. A Harvard study back in 2014 found an association between regular consumption of yogurt, but not other forms of dairy, and a lower type 2 risk. Maybe something about the live bacteria cultures, but they're not really sure. The author of that study said yogurt is unlikely to prevent diabetes on its own. It is often loaded with added sugars, so look out for that. Yogurt, these researchers say, is not a magic bullet. And finally, Beyond Type 1's Beyond Scholars is back. This is a scholarship program designed specifically for the diabetes community. It offers scholarships of up to $5,000 for students living with diabetes as they pursue their educational dreams. We have the link to this in the show notes. This was originally founded as the Diabetes Scholars Foundation in 2008. Beyond Type 1 took it in 2018. And in the last 15 years, they've provided students with more than $2 million in scholarship money. Again, if you want to apply, just head over to diabetes-connections.com or click the show notes wherever you're listening. And that's it for In the News. If you like it, please share it. We'll be back next week with our longer format interview shows. Until then, I'm Stacey Sims. Be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.